Hi, I'm Todd Kiesling and I'm a certified athletic trainer with Rejuv Medical. Today we're talking about shoulder injuries, and if you haven't already done so, it might be good to review the shoulder anatomy on one of the other videos or to read the script on our website. Right now we're talking about rotator cuff tears. How do we get rotator cuff tears? Well, there are two basic ways. One is called an acute rotator cuff tear. The other one's a little more chronic and slower progressing, and it's more of a degeneration called rotator cuff disease. Acute tears, those occur suddenly and quite often very forcefully. For example, a 20-year-old college football player, while a strong, healthy athlete, can still have an acute rotator cuff tear from a sudden injury when falling in a pile-up onto an outstretched arm, or when the pile collapses and the arm gets put into a bad position and stressed very quickly. In this instance, the rotator cuff tear can be a splitting type fashion or can be pulled or avulsed from the bone. It happens suddenly and in a very fast and forceful manner. Another example is a 30-year-old starting their mower for the first time of the season, expecting the rope to pull all the way out the full distance. If the engine is seized and the piston is frozen in place, the rope won't pull very far, and all of a sudden there's going to be a quick stop at the very end. Again, a very sudden, forceful injury. The tear in the rotator cuff tendon can be complete and rupture the tendon, the structure that connects the muscle to the bone. It could also be what's known as a partial thickness rotator cuff tear, and that's kind of like cutting partway through a steak to see how well done it may be in the middle. Other times, rotator cuff tears can be full thickness tears without going all the way across the width of the tendon, and those are more like a hole that goes all the way through the thickness of the tendon but not across the width. These various types of rotator cuff tears most commonly occur at the top muscle on the rotator cuff, the supraspinatus, but they could also occur to the infraspinatus, subscapularis, or even teres minor. There can also be multiple tears in tendons from the same injury.